Hi, everybody. If anybody can hear me.
Hi, Jay.
Hi, Brianna. Oh, hi, Brianna.
How are you?
I'm good. How are you all?
Good.
Right.
Excited to get this going. It's been in the planning for quite some time.
Yeah, it'll be great.
Yeah, for sure. Ragini, do you want to run through any logistics?
No, just whenever Jessica is done introducing you, Jay, then you can just share your screen and have your PowerPoint up and just run through it.
Right. Let me try to. Can I just share my screen right now to sort of see whether you get it?
Mm-hmm.
Yeah.
Does it work?
Yep.
Mm-hmm.
How do I? Now the question is, how do I move forward?
Try clicking on.
Let me try to do this again.
Because sometimes it like lags a little bit, and as long as you click on your presentation, then you should be able to move through fine.
Let's see here. Speaker view. Share screen. Oh, that works. Okay, I think that works.
Yeah.
Perfect.
Okay. All right, stop share.
Okay.
How many people have you gotten? What's your registration?
Registration is at 1:30.
Wow. Expecting more than that, or?
Probably less.
Yeah, the virtual thing has both pros and cons. You know that, right? I mean, you have more people who can join, and then but there's a piece of that's missing when you do only virtual. But I have been on, oh my God, many meetings, trainings on Zoom. It's exhausting. It's actually more exhausting than being up there for on the stage or something. So
I feel that too for some reason. Yeah.
yeah, I mean it's yeah. But we'll see. Hopefully, I've kind of done similar presentations like this. It's the feedback is different every time, so we'll see how this goes. So.
Definitely.
Okay, I gotta share my screen. Yeah. Okay. Cool. Can you see my all my buttons and everything?
I can see your slide.
It's
Okay,
just the slide.
Okay. Okay. I think we have. Trying to get to see if there's anyone else that we have to have on before we go live. There's Angela. Should I put Angela in too?
Up to you. I know she's not doing the welcome today, so it might be good to have her as a co-host in case we need her to hop on or something, or
Okay.
Go on chat or something like that.
Okay.
But we can leave it up to her too.
Mm-hmm. Do you know if Myrna is going to come later or now?
A little bit later.
Yeah.
She said at about 1:30.
Okay. Okay, I was just looking for her as well. And then,
Yeah.
So it wouldn't let me put Steven's email in. It kept saying it's not registered with a Zoom account, but it got me to do Jessica. So he might have to register and then have and then I can put him as a host.
Okay, sounds good. So when you get started, I'm gonna hop off screen until Jay completes his presentation, and then I'll hop back on and on video and everything.
Sounds good.
Okay.
Do you mind admitting people?
Yeah, absolutely.
Thank you.
Should we do it right at 1, or do we want to send a message at 1 that says, hey, we'll get started in a couple minutes?
We can do it 1 just so I can get my little short welcome in, and then do the Mentimeter thing, and then just want to make sure everything's on time and people can, the main piece will be Jay's. So like while that's happening, people can trickle in and stuff. So
perfect. Yes. So I will go ahead and admit all in a couple of minutes. And then I'll keep admitting folks while you're speaking, and then once you hop off, we can both kind of monitor.
Okay, sounds good.
Cool.
Okay. Hey, Ragini, this is Angela. I'm on. My video is off. I'm in the background. If you need me for anything throughout this, background support, help with the admittance or whatever, monitoring chat box stuff, just let me know. And I've got my phone here too if you want to shoot me a text at any point to kind of help just with whatever support you all need in the background.
Okay, I'll make you a co-host then.
Okay.
Yeah.
So Brianna or whoever, can you please give me a signal when I am coming up to 1:45, because I do want to have 10 minutes for Q&A. So if I'm coming up to that 5 minutes, 1:45, so I know I have about 5 minutes, and because I feel like it's a good, I would like to be able to do Q&A for 10 minutes. So if somebody can just either remind me through the chat that,
Yeah, we can, I can just put the time in and just enter it on the chat box.
Okay. Yeah, and say, yeah, because I feel like maybe it's a good opportunity to do some Q&A.
Yeah, absolutely.
Jessica,
okay.
just to get you ready, I'm going to be controversial, so just.
I love it. I can't wait.
Okay.
And what I'll do is I'll introduce you, Jay, and then I will also pop my camera off so that all they see is you when you're doing your presentation.
Okay.
All right, I'm gonna go ahead and let everyone in just a sec. So Ragini, you can get started as you see people coming.
Okay. All right. Welcome, everyone. Welcome to the 2020 Summer Multicultural Symposium. It's a 3-day series virtual event. Thank you all for being here. I just want to go over a couple housekeeping things with you before we really dive into the content. I want to make sure this is as interactive as possible for everyone. So we're going to be using the system called Mentimeter. So all you need to do is go to menti.com and use the code 986150. I'll type that into the chat box in just a second. But yeah, so this is just a way to kind of like either do Q&A and then do evaluations throughout the day. It's self-paced. Let me see if I can move on to the next slide. This is how it works. And it's just kind of a visual. You type in menti.com either in your other tab, or it's easiest to use on the phone so you can follow the presentation as well as being on menti.com. And then the code is 986150, which is right here. And then it's evaluation at your own pace. So you'll be able to kind of go through your own pace, and you know, we'll have questions about like my community sees mental health as, or a quote or like a phrase that helps you get going through life. And then there's also things like the Q&A session that we're going to have. There's going to be a Q&A screen that I'm going to pop up. And then just simple things like that, an evaluation, kind of just asking for your opinions on how each part of our sessions go. So today we're going to have our first keynote address in a few minutes, and then we're going to have a 5-minute break and then a workshop at 2. There's going to be more details in just a few seconds. And then another way to participate, you can type into the chat box if you have any questions or comments. When we get to the Q&A, you'll be able to either use the menti.com Q&A, raise your hand and use your voice, or type into the chat box. So if you're having any tech issues or anything like that, just let me know on the chat box and we'll see what we can do. If you're having audio issues, we recommend calling in through your phone. There's an option to use your phone, so you can also do that. And this is one of the questions that came up. Looks like we already have someone answering. Thank you so much for participating. So yeah, I just wanted to go over this quick little section, just all the tech stuff. If you have any more questions, please feel free to put them in the chat box and I'll respond to them as fast as I can. So just to get started, I would like to introduce everyone to Jessica Cruz. She's the CEO of NAMI California. Jessica.
Thanks, Ragini. Can everybody hear me okay? You're all muted, but I'm so happy that you're here. This is actually over the last 6 years, NAMI California has put together this multicultural symposium. It really started out as a need within our communities to bring not only our NAMI affiliates and members, but those from the various different communities that they serve together in one room to talk about what does it mean to live in the LGBT community, in the Asian Pacific Islander community, or the African American community with mental illness, and how, as NAMI, can we help bridge some gaps to not only educate each other and one another about these issues, but also to be able to provide the best services possible and connect families and individuals together. And so back in 2014, we held our very first multicultural symposium. And since then, it has grown not only a statewide symposium, but also to these regional symposiums over the last couple years, where we've actually been able to localize the symposiums and bring regions together to have these conversations. It's my pleasure to introduce Dr. Jay Africa, who is not only NAMI California's executive board member, but a fierce advocate for racial, ethnic, and injustices and justice in this world. His voice just brings so much light. His passion, his dedication moves people, including myself, to be motivated for change. And Dr. Africa has a long history of accolades. Currently the behavioral health director of Marin County. He has innovative leadership. He's been a clinician. He has done counseling, teaching, consulting in private and public practice, and focuses in areas of trauma, health equity, and diversity. You know, he again is one of those quiet leaders that we feel so honored to have, not only on the NAMI California board as a consultant and a mentor, but also as an expert in this area. So I am so pleased that he's here today to talk to you all. So welcome, Dr. Africa.
Thanks, Jessica, and good afternoon, everybody. So let me try to put up my slides. It says that I'm disabled, so if you can help me put up my slides, that would be great. Technology at its best, and we practiced this earlier. Brianna, would you mind? Okay, here we go. Okay, all right.
Try again, yeah.
Here we go. All right, and let me put up my slide here. And again, thank you, Jessica, for, I think people can see me or see the slide. I don't want to see myself, to be honest with you. And it's really a pleasure to be part of this symposium. I have really sort of been involved with NAMI California for a few years, and really have just really appreciated sort of the work that they've done. So today, I wanted to talk about why we should bring conversations about race and racism to the table. I am not a historian, you know, this is sort of not my expertise. I'm a storyteller mostly, I'm a clinician. So what I would like to do today is really just pretty much sort of a conversation of like why I think it's really important to bring conversations of race. But we do, before I start though, I want to kind of do a trigger warning. It's really just important. And I say this out of love and respect that if you might feel uncomfortable during this talk, which is actually not necessarily a bad sign. It means that something in your body and in your mind is thinking and being provoked. I would just invite you to just sit with that discomfort, and then maybe you know, later on the day to reflect on what was the discomfort is all about. But if it gets to a point that you need support because you are so enraged, triggered by what I'm talking about, I would take this moment now to think about who would that person you would want to talk to and that you trust that you are going to reach out to. Because I really think, you know, these conversations oftentimes can be hard and challenging, but I think it's necessary as we are thinking about transforming our community to be much more coming to our North Star of really equity and inclusion. So I always talk about where I come from, and it's really important to share that with you because it gives you a context of how I see the world. So I grew up in the Philippines, and that's in Southeast Asia. And one of the things, or the things that I want you to know about the Philippines is that we were under the Spanish rule and we were colonized by Spaniards about over 300 years. And in that history of colonization, there are both pros and cons with that. But what we, sort of in a snippet, what we learned is really the significance of understanding roles that are determined by gender, and really the importance of religion, particularly Christianity. And you'll probably hear that later on. When the Spaniards sold us to the United States, we were under the US influence for about 40 plus years. And under the United States, we kind of learned the concepts of the importance of education, of capitalism, right, of consumerism, and learning the importance of English. So you probably know that there are many Filipinos or many folks that grew up in the Philippines that actually speak English, although that might sort of be different depending on the levels of education. And many of probably folks that don't know is that we were under the Japanese rule for about 5 years. And although that is quite short in our history, that really sort of also impacted a little bit of our culture. So in the slide that you can see that the Philippines is actually made up of 7,107 islands. So it's really a nation of many different cultures that are really trying to kind of be one. And that will sort of explain to you why that's important for me. And if you probably had asked of why mental health is important to me, I have a person who has lived experience as a family member. I would say a number of my family members have a mental health and a substance abuse condition. And I show this picture of me and my family when I was, I would say 3 or 4, and I'm the one sitting right on my mom's lap. And the reason why I talk about this is really the influence of my family on who I am as a person. And the one thing that's really poignant in my work and who I am is a story that when I was growing up, my sister on the left there near my father was very adventurous, and she, you know, had an early age really were able to travel around the world through her education and to just what she was interested in. And perhaps maybe in her early 20s, she had come home talking to my parents about meeting this wonderful guy overseas, and had spoken about really why it was important for her to, you know, to sort of talk about her love life. And rightfully so, I remember during that conversation, my mom said, you can bring anybody you want from any parts of this world as your boyfriend, but don't bring a black guy. And you know, at a young age, I didn't quite understand what that meant. But it really stayed with me. And as I sort of grew up and became sort of a professional, of really understanding where that came from and really digging deep into my soul of really sort of racism to its core. And even if I grew up in the Philippines where people's skin color were fairly the same, racism was pretty apparent because again of our sort of our influence in sort of my work. So can you see my share on my screen again? Yes, okay. I want to just make sure that that's the case. All right, so that's my family. And then if you are sort of interested to know why I am in the field of mental health, I'm gonna try to do this again, do my best here, of why I chose mental health is because again of some of that of lived experience and really wanting to be in a field that really helps people who have mental health conditions to continue living their life in recovery. So we are all here in this setting. We're doing virtual world because of what this small tiny sort of thing in the world that really created a big shift in our lives, the coronavirus. And as we were preparing to do shelter in place, as we were responding to really getting people to be safe and take care of what they needed to do, we started sort of seeing the impact of what this small virus could be in people's lives. So as the counties, hospitals, everybody was paying attention to that. The death of many of our African American, I would say, sort of siblings also became sort of a prominent issue that we needed to face. In my work as the behavioral health director in Marin, trying to sort out like, how do I respond to COVID? And then also, how do I respond authentically to what was sort of going on in this racial unrest that was happening in our country. And then, in all of the midst of this chaos and this uprising, one of the things that really was sort of came apparent to me is this one little tool that really, I think, created a bigger conversation that really, I think, really kind of deeply affected me, of mask wearing, right? And, for all of us that think about like, well, yeah, you really need to wear a mask for you to prevent the transmission of the virus. But actually the mask wearing or being able to wear a mask created some more conversations about race. So Pew Research came about, sort of a research and saying like among the communities that were, that were having to go through sort of COVID and having to deal with that, how many of these communities were sort of being negatively affected by it? So here in this graph, you can see the question of how many percent were of people activists they were uncomfortable around. And most respondents who were Black and Asian responded, yeah, I really felt that people were treating me differently because of my race or my ethnicity. And then how many of you were being exposed to jokes and slurs that sort of were related because of maybe your race and ethnicity? And again, in that sort of our Asian community. And then feared that someone might actually threaten or physically harm them. A big number, again, is sort of our Asian community, but our Black community also were sort of sharing some of the other experiences, right? And then you started asking, well, it is sort of now a necessity to wear a mask. And how many of you are worried that you will either get sort of negative behaviors because of or people find you suspicious because of your mask wearing? And lo and behold, it's pretty much sort of the same community that we're sort of reacting, or we're saying that, yeah, I'm fearing about some of these things. So a lot of our Asian and African American community. Out of that, because of all the things that were happening and this administration of, saying like where this virus came from and, having all these derogatory terms about the virus, there is actually a cohort of colleagues from San Francisco and colleagues in Southern California that created a sort of a collaboration called Stop AAPI Hate. because they were seeing many of these racist behaviors towards Asian because of what was sort of the narrative of where the virus came from. And from a study when they started in March till about April, folks were actually reporting almost 1,700 corona-related incidents against Asian community. Most were about verbal harassments. Some were physical assaults. We've actually seen them on YouTube and virally, that people were really treating folks kind of differently because of their sort of assumption of where this virus came from. That also, I think, was related to their race. And then you have now sort of a conversation. This actually came about not so long ago, about a month ago, when the mask wearing also had effect with sort of obviously with our African American community. And in this article, it talked about, you know, which death would you rather choose? Because if you wore the mask, you know, the fear, right? The fear of being a criminal, all the sort of notions that has sort of been rampant, it had really sort of risen up. And then the question, but if you didn't wear the mask, the possibility that you would get infected by the virus was also persistent. And so I really started thinking about, you know, more and more digging of like all the conversations that were happening, that, wow, because of race or the skin color or the perceived skin color, that there are all these issues that were really being affected that we have not really talked about. And then, and I thought about, well, what could be that elephant in the room, right? And people have started talking about that when they started about looking at really bringing the data more of who are being infected in the COVID-19. And so I figured, well, really the elephant in the room is really racism, right? And so I talked about, well, I think we should really start talking more about really bringing up this conversation in all facets of our work, not just with obviously the racial injustice, but the coronavirus. And so I came across this quote from James Baldwin, that not everything that is faced can be changed, but nothing can be changed until it's faced. And so one of the things that I have really been trying to do is really bring the conversations that really we should have or continue to have in sort of our everyday conversation. So what's the conversation? What's really the conversation? The conversation is racism kills, right? And it could be that it could kill deliberately because of forced, you know, deprivation, discrimination, like all the things that we're seeing. But also it is a fundamental cause of disease in the strange and cause of this from what we are familiar with in terms of racial health inequities. And it's so interesting that this article that actually came from Health Affairs that literally was just published a week ago said, we have to really be having the conversation about how racism kills us more deliberately more than ever. And so part of really what I wanted to bring up is really, why do we need to have this conversation? But before we go that, I wanted to clarify a few things, right? So we have sort of this notion, we have to led to believe that we learn that race actually is a biological construct. It is actually not. The concept of race, that we are similar because of some biological basis, has been disproven many, many times. So it is a construct that was created by folks centuries ago to create categories of who gets resources and who doesn't. We know from the Human Genome Project that there is no biological basis to race. What we really should be talking about, because we talk about race demographics, and we're gonna see that a little bit about the data, is really not just race, but really talking about racism. And when we talk about racism, we talk about a sort of a system, a social system that reinforces some sort of inequity between groups that unfairly disadvantages some individuals and communities and advantages others. I'm going to say it again. It is a social system that we've created, right? People have created, that creates this really unfairly disadvantages people and fairly advantages people. And we're going to talk about that a little bit more and what I mean. But one of the things that really was apparent to me and kind of really doing some soul searching is the understanding of the process of racialization, that we are actually, as we grow up and learn these behaviors, that we go through this process called racialization, which John Powell, really eminent scholar talking about othering and belonging, talks about a process by which we create meaning and value that is ascribed or aligned to a certain racial category, right? So we, as we are growing up in school, learning all of these things in our community, that we create meaning and ascribing value to racial groups in our community. And that each of this racial group occupies a position in the social hierarchy that we created. So there are people who are inferior and there are people who are inferior. That there are people who will get more and there are people who will not get more. There are people that are within the group and considered the norm, and there are people that are outsiders. That's the process that we are living in right now. You belong or you don't. You belong to this category and therefore you get these things, or you belong to this specific social category or you don't belong, that you don't belong to that. And so you don't get any of the resources or the potential opportunities because you don't belong. So I want to talk about this a little bit more because this is really deep stuff. When we talk about racism, most people say, I'm not a racist, or I'm not engaging in a racist behavior. What I'm really talking about today, and I want to really sort of emphasize, that there are many dimensions of racism. Most of us, when we are in this conversation of, I am not a racist, we are only talking about interpersonal or internalized messages about race, right? So it's our own understanding of what race is and how we go about involving or talking or relating to other people. So when somebody tells you I'm not a racist, most of the time they're talking about me as an individual, me in my relationship with you perhaps. But what really I'm wanting for us to get through today is the significance of talking about beyond just the individual, right? Talking about that we are in institutions, we are in a community structurally that continue to support structural policies that support racism, right? And so when we are able to detach ourselves from being, it's just an individual perspective and look at the systems, we are able to think about what are the kinds of transformative changes that we need to do as leaders in organizations, as CEOs, as program directors overseeing programs, because we're not just looking at ourselves per se, but we're looking about what are the policies, the structures, the programs that we create so that what we need to change the narrative of people. So again, what I want to talk about today is really just beyond just the internalized individual racism. It's really talking about what are the things that we need to do to change the structures, policies, organizations, programs that really tend to really affect people differently than just one person. So I'm not going to talk about this, but I happen to just read a work done by Dr. Maria from UCSF that talks about, and here's now I'm reminding you about the trigger warning. If you're feeling uncomfortable or if you're being provoked by this, that really the basis of what we really are talking about really stems from the concept of supremacy, right? The supremacy is that I am superior in my race, my class, my people, my beliefs are superior than anybody else. That's one of the impact of colonization, right? We are a country. I grew up in a country that was colonized. We have the U.S. is sort of a, many people came here. We were sort of a colony of, England for a while. And so really that one of the manifestations of that colonization is the concept of supremacy. And in Dr. Maria's conversation, she talks about supremacy can be seen in multiple ways. White supremacy, male supremacy, or what we know as patriarchy, that the notion that men or males are better, right? And then the concept of human supremacy. And when we talk about human supremacy, it's the belief that I am more important than anything in the world. And that also talks about why I don't care about the environment. And if you are not paying attention to what's happening in this environment, we are literally killing the environment. And that talks about that we think that we are better than the environment. And this notion of not protecting it so that we can survive is really problematic. So I want to ground that, because oftentimes when we talk about supremacy, the next concept is white supremacy, right? And I have been in many, many discussions for 2 decades that when we talk about racism, you know, people often talk about, well, this racial injustice, you know, what's happening. And really for me, one of the core issues that we really need to bring up is the concept of white supremacy. The concept of white supremacy is the assumption that whiteness is a norm, right? And it's not white people per se, but it's the ideology of whiteness. I'm not gonna spend a lot of time talking about that today, but hopefully through some examples, you will sort of see what I mean. And in that concept of white supremacy, right, we often know the notion that whites are dominant than other people is very, very common. The concept of white supremacy legitimized this country to really support slavery and genocide. Actually genocide across, not just here in this country, but genocide in other places, right? We killed many Native indigenous people in this country in the glory of colonizing them or teaching them or educating them, right? We brought in slaves, again, in Dr. Maria's depiction, so that they can be our labor force, because capitalism and being able to produce really would help us economically, right? So that's really the concept of white supremacy. Now you're probably thinking, well, you know, what about the KKKs? Oh, you know, the neo-Nazis. I think that's part of white supremacy, but that's really not what we often refer to the structural ideology of white supremacy. You can be a well-meaning person, but support maybe sometimes, you know, a person of color that also supports white supremacy, because you have learned that. And I want to really make sure that when we talk about these issues, these are painful issues, but unless we really talk about accepting the ideology of whiteness as the superior ideology, we cannot talk about racial injustice, and we cannot transform our communities and our society to do better. So let's talk about structural racism, right? And as I said, you know, structural racism is really the root cause of many of the health disparities and the inequities that we see in health. It's not the individualized or internalized racism that creates the narrative that I'm going to show you. It's structures that we've created in place that we continue to support to create this racist sort of ideologies. So this came out in July, a week ago, from New York Times, when they looked at how many people are being affected by the coronavirus per 100,000. I don't have to explain to you, our Black and Latino population communities are being affected at a disproportionately high rate, right? We know that. We started looking, these kinds of, this data is not new to us. We've seen that in other viruses. We've seen that in other issues where Black and brown people in the US continue to experience poor health to white people compared to white people, right? And it's not, again, just the individual behavior. It's really how social institutions and others treat these individuals or these communities. We also see that Black and brown people are less likely to have access to wealth and resources. And we know that drives, right, how people get access to care, right? So for example, in a study in 2018, about 11.5% of Black adults in the US had no form of health insurance. And it really is sort of and now where health insurance, you know, can get you more access to care, doesn't guarantee you, unfortunately, great access to care, but it guarantees you at least access to care. And then despite of the needs that we're sort of seeing, 1 in 3 African-American adults who need mental health care only receive it, right? So again, and then also 33% of Latino adults with mental illness receive treatment each year compared to about 43%, right? So you're probably saying, well, that's not necessarily the individual's fault. It's really the structures that we've created that continue to perpetuate sort of these challenges that we're seeing. But these are not new to us at this point, right? NAMI has done some work in it. Some of our providers, CBO says the Mental Health America, some of our providers, County Behavioral Health has done, we know this, our public health colleagues have done this, and yet we continue to be confronted by the same data. So what have we seen, right, in the things that have emerged due to COVID? Same data, right? An African American, although they account for 13% of the population, we see 24% of the deaths. In eight of the states, we see that, they are twice the population in terms of deaths. American Indian, Alaska Native, pretty much in 3 different states, although it's 11%. Although they're 4% of the population, in Arizona, 11% of the cases, 18% of the deaths. New Mexico, 9% of the population, 57% cases. Wyoming, 2% of population, and 30%, right, of the cases. Same with our Latino and Hispanic population, right? So the data is pretty much saying the same thing. So what is sort of happening as you're thinking about this, right? And really is sort of compelling us and saying, like, we've known all of this data for a while. Why aren't we doing anything about it? Well, it really points out too, and we've really talked about it more and more, is structural racism, right? And so I really tried my best to figure out, well, how can structural racism explain some of these issues that we're sort of continuing to see? From an environment perspective, right? Blacks and Hispanics continue to live in communities where they're exposed to higher levels of pollution. So we have a lot of folks that have, high asthma rates. We think about COVID affects the respiratory system. We know though that people of color are less likely to be able to work at home, right? Who are the people that can afford to do telework? What kinds of jobs that people can go to do telework? Many of the frontline workers, grocery shops, restaurant folks, people are really being staffed by communities of color or people of color, right? Really low paid jobs. Some of them don't even have sick time. Some of them, can't get really good access to good medical care through their insurance, for example. And then we look at the next structure, right? Which is really the inequities related to the social determinants. And I'm kind of going to break down housing, right? Who can afford really sort of housing that, that have enough space. We have families that have multiple generations living in a 1-bedroom apartment. And when you think about spreading COVID, for example, right, then that really sort of is a kind of a petri dish for folks that, because they're living in close quarters. Food security, right? So one of the things that really help us is to be able to, get healthy foods. And, and who has food security? Who are the folks that really on a daily basis, weekly basis, have to choose whether it's the rent that I'm going to pay or it's the food that I'm going to, or it's really healthy food. And then, when we talk about structures, we talk about insurance, level of insurance. Who tends to be uninsured in this country, right? Again, so 24%, almost 25%, compared to 8% of whites, and then about 15% of African Americans tend to be likely uninsured. And then the sad part, and even if we're doing, we're trying to do a great job here, that really the implicit bias that our healthcare system have learned over through the centuries of sort of racialized lens, right? That is guaranteed and fully documented that we have providers that really don't have the skills, but also have implicit bias that when they are treating and working with people, that their implicit bias really gets in the way of culturally appropriate care, that sometimes harm the folks that try to get in the care, that then creates this notion of like, I'm not trusting this provider, so I'm not interested in coming back. It is also important for you to remember that public health institutions have played a historic, and actually other institutions have played sort of a historic role in forced sterilization in this country. That because you are either deemed as inferior for whether skin color, maybe gender, also potential criminality, that you would be going to a doctor without knowing that they would sterilize you, right? And without your consent. And so we have really created sort of these structures and that continue sort of this racialized perspectives. So, you know, I wish I had more time with you, but, you know, I really had to kind of put it all together quickly and kind of engage you in a conversation. But my sense of this is these kind of difficult conversations have been avoided for a long time. And perhaps the reason why we kind of continue to avoid it is because it really managed, you know, or controlled who gets to continue the resources and who gets not, but also control who manages the power and the privilege, right? I don't necessarily believe that that we have really been able to really engage in hard conversations because we didn't want to, because I think there was really a reason why we avoided it, didn't want to have it. It was too painful, but we also maybe inadvertently or implicitly wanted to be able to continue who has the power and who has the privilege in this country, which continues to do so. I also wanted to just say, I really did a little, as I kept on saying, this my own journey about why it's important to me, that many of us have substituted the conversation focused only on race versus racism, right? It's easier. I know it's been difficult because whenever I talk about race, people always say, well, what about gender? What about age? What about poverty and economic class? And that's been really difficult. But I also say that it's actually when people are ready to have that conversation, they have, it's been easier to talk about race per se as a noun, as a description, than talking about really racism. And actually in this study that came out again from Health Affairs, they did a poll, right? Lancet is one of the most prestigious journals, medical journals in the world. And they actually did a meta-analysis, and they said most of the journals that they see only use race, but never use the word structural racism or systemic racism. The Health Affairs website literally did a kind of scan within its 39-year history as a journal, which is also very prestigious journal, and found only 114 pieces that use the word racism. And then again, using doing a research on public health literature from 2002 to 2015, only about 15 of those articles use the word institutionalized racism. And then last one is a PubMed research. I am familiar with PubMeds when I was doing my dissertation of really using all these listserv that documents all publications related to anyone pretty much in the world. Done about a month ago, not even a month ago, that only revealed about 86 articles that really talked about structural racism or institutional racism. And 32, a third of these articles only came up within the last 18 months. So there is really a discomfort talking about racism and structural racism. We have mostly focusing it on just the description and using race as a noun, right? And not really taking into consideration or really coming front and center that really the race is not the problem. What the problem is really is the effects of racism and really the structural racism that we are focusing in. So I want to sort of, as I'm dying, I'm not dying, as I'm sort of closing, I want to talk about, well, what can we do? I don't want to leave with sort of the sense of hopelessness. You know, I'm hoping that you can sort of get some idea of some of the things that like on what you can do, because I feel like we can do, everyone can do something, is to be clear about what we stand for, what you stand for, and making it visible. I think if you are in an organization, to be clear about your organizational values and be specific about how you are working towards these values. I appreciate that people are putting out messages and emails, but after that, words don't matter if there's no action. Continue to create brave spaces and conversations so that people can continue to have this dialogue. I will tell you that in sort of this work since COVID started, I have been in many virtual conversations, leading leadership conversations. When many of our leaders say like, I don't want to create that because I don't, it'll stir up many uncomfortable conversations, and I actually don't feel like this is the space to do it. We have to talk about it because this is affecting people's lives, right? We have to create brave spaces and give the skills for people to facilitate these kinds of conversations. Number 4, we have to partner with communities. We cannot change the narrative of people if we don't partner with communities and engage them. Public servants can't do it alone. Hospitals can't do it alone. We have to come together and partner with communities and that do this work and are in ground, because we cannot do this by ourselves. More importantly, is to really invest in sustainable infrastructure, not thinking about the now or short term, but really long-term sustainability. We have many great leaders that really are championing the work of social justice. But if they leave, they retire, we often wonder who's going to continue that legacy if there are not built infrastructures to continue that. I can be a good social justice leader, but I am not doing a good job if I don't create the infrastructures to sustain the work. So what's the transformation that I think is needed as I'm sort of ending? And I want to just quote Shakti Butler, Dr. Shakti Butler, who is sort of the CEO of World Trust, when she said, we really need collective efforts to redress the power, the economics, and the cultural base of our being. But more importantly, we have to drive the creation of a new system and structure with structures that highlight community safety, economic safety, and the kind of healing that knit people into wholeness. Because we are in a system or in a country or a community that breaks people's wellness into different parts. And to really transform this work is to bring people into wholeness, whatever parts of that wholeness will be. So I want to end, I think I have 1 or 2 slides, by saying most of us have seen sort of the different variations of the difference between equality, equity, and inequality. And I actually wanted to just show you a different version, which really, what is our North Star? The North Star for me isn't really about equity. The North Star really is about justice, right? Inequality, you see that there's 2 young people, one gets the apple and one doesn't get the apple. That's inequality. Equality is both of them get the same size type of ladder to be able to get, you know, the apple, still even with the ladder, that person on the right isn't getting anything. Equity means, well, the person on the right needs a different height of ladder so that they can reach more. But still, in my opinion, that description is still blaming the individual. You are not tall enough, right, to reach the apple, so that's why we're giving you the instrument. But really, what we are talking about is shifting the structure, right? And here in the last picture, the shifting of the structure means putting some wood to the tree so that the tree stands up quite erect so that they can both have what they need. So in this diagram, it's not blaming the individual. That's really, we're shifting away from that, but really saying it's the structures that we created that continue to perpetuate this inequity. That's the perspective. That's the transformation that we need. Because once we identify that it's the system and not the individual per se, we can have that hard conversations and really change people's perspectives and people's hearts. And not say, I'm not a racist. I don't know why we even have this conversation. I'm not a racist. Because we're not really just talking about you as a racist person. We're talking about racist policies and infrastructure. So our transformation and our North Star really is about justice by changing the structures. So I want to end by one of my favorite activists. I had learned a little bit about her work when I came to this country, from Angela Davis. And she says, based off from the Serenity Prayer, she's kind of tweaked that off a little bit by saying, I am no longer accepting the things I cannot change. I am changing the things I cannot accept. And my hope is that it really says to you, well, times are different and we should really do something differently. If it's not acceptable to you, we should change it. And you're probably asking why it's really important, because this is really a crucial and pivotal time for us to really make the change that is really needed to change the narrative of all people and not just one person. So with that, I want to, sort of pause for a little bit. I think we have some time for questions. I'm sorry, I wasn't sort of paying attention to the feedback. So I'm going to stop my slide sharing and open it up for a few minutes. Brianna, if that's okay.
Yes, absolutely. Thank you, Jay, so much. We so appreciate you talking about this. We're really excited to get, people who are listening in kind of on the same wavelength. We're getting a lot of comments right now just popping up that you're an inspiration to us all. So just thank you so much, Jay, for your perspective. We really appreciate you. Before we jump into questions, we're going to have a full 15-minute session. So we did run a little bit over, but we'll have a full 15-minute session of Q&A, and then we'll take a 5-minute break and move into our workshop. So just to kind of start, before we start taking some questions, feel free to type into the chat box right now if you all have questions or comments. Also, let me know if you'd like to actually ask your question live and we can unmute you, whatever works for you. And then we also have the Mentimeter running, so you can also do it that way. There are quite a few ways for you to participate. But just to kind of start, Jay, we know that you're a practicing clinician and that you're also the Director of Behavioral Health and Recovery Services. So in your leadership roles, how have people responded to this notion that you are kind of no longer allowing it to go silent and bringing it forward and bringing it to the table in the spaces that you take up?
Well, I don't think there's an easy answer. I often operate from the sense of you lead with yourself first. Like, I have to be comfortable with really understanding to the best of my capability what I'm talking about and what are the consequences of not talking about this. And, I have embraced the fact that everybody has a role in playing and changing the narrative of people. I have to just be authentic because, I grew up, again, understanding why it's important, understand the concept of belongingness, right? And, as a person of color, as an immigrant, as a transgender individual, of my own multiple intersectionalities of being othered and treated differently because of that. And so but also have the privilege of being supported by people who have been in power and are in positions that supported me. And I really just want to give back. I want to really change the story of people who are continuing to suffer because, I know how it's like to be a family member when they are not able to get the resources that they need. I need to be patient, that not everybody will understand it. Not everybody will get it. But if I am invested in it and also embrace it, then maybe if I can change one person, that's the therapist in me, right? That's the therapist in me, is one person can make a difference. That I am so grateful that I am a psychologist, that my training is about building relationships, that the privilege to hear people's stories, and that carries me into really difficult conversations. I've been called a chink because I'm Asian. I've been called a tranny, right? And although it's painful, I really just reframe it and like, what can I do in that moment to change, to engage people in a conversation when it feels safe, right? There are moments where I don't feel safe, so I don't engage. But my role is I want to be authentic to myself. And I feel like as leaders, the mere position that we are CEOs, program directors, that we're educated, that we can speak English, that we have the opportunity to really change people's lives. And I think, I turned 50 this year, and I figured there are people who will agree with me and there are people who won't. And, I can engage people in that kind of conversation or not. But I feel like you just need to be authentic. And this is something that I've seen, I believe in. I see that in my private practice. I see it in the work that I do, leading a behavioral health organization.
Awesome. Thank you so much, Jay. Okay, we do have some comments in the chat box, so hopefully you can see those comments directly for you. And then we do have on the Mentimeter, we'll start off with this first question, and Ragini will be clicking through the questions.
And can I just tell you that, more and more are people really, there's still a lot of discomfort, this kind of conversation. When I talk about white supremacy and whiteness, people do either a 180 turn. And I feel like part of the messaging is really like, we really need to start bringing up the white elephant or whatever elephant in the room is, that these disparities that we're seeing, the problems in access, the problems in people's experiences seeking behavioral health and healthcare services is not because of just one individual. It's really the structures that we created and this ideology that we continue to support, even sometimes unintentionally, because we don't name it, we don't talk about it, and we don't really push the issue. And there's just a lot in discomfort, but I feel like over time, when it becomes normalized, we are going to be able to have an easier conversation about it. But because we don't name it, and we've really avoided it, it kind of remains just sort of this nameless ghost or blob, that we have to deal with, but that continues to affect us.
Absolutely. All right. So we have the next one that just popped up here. How do we push organizations to invest in anti-racism and self-reflection?
I mean, I think I shared you that slide that, what can people do? I think being very clear and explicit about the core value of having social justice as part of your mission and vision. I think it's to create spaces where people can engage conversations. And I'm thinking about if you're doing a NAMI group, right? If you're doing a family-to-family group, to bring about, what are the conversations that are probably affecting families that maybe are different because of their of racism, right? So I think creating that space in our curriculum to do that. I think as leaders, we have to create space in our organizations to do it, but more importantly, invest in people to lead these conversations. My worry is that you have a few people that they're passionate about this work, they're doing all the self-reflection, they're doing all the work, but when they leave, it goes away. What you need is that the infrastructure to continue to maintain it, so that when I retire, hopefully the work that I've put in, the seeds that I put in, continue to blossom and be taken over by the next person, right? That's really what is needed. The history of slavery in this country didn't go away with one person. It was passed on to generations and generations. That's the legacy of structural racism, right? So how can we change that? Is we create infrastructures that will go past our time. Because if we don't continue that, then it goes away.
Great points. Thank you so much, Jay. We'll move on to the next one now. Thank you, Ragini. So the next question, how do we eliminate police brutality against people of color going forward? Is police brutality a form of structural racism?
I'll tell you that, I've been doing a lot of reading and research about that. And then, I don't know if I have a fully formed kind of understanding, but, and as I was really understanding sort of the history of slavery, of like what happened, and really understanding of how are law enforcement created in this country. Like if you look at the history of police, right, they started in the story of slaves, that they were the ones that were being asked when there are people who were slaves were running away to get them, to punish them, right? So that's sort of the history of law enforcement. So for me, of thinking about like, gosh, even where it come from really sounds sick and painful. And how do you then, and that has sort of been carried on through generations. But then, and then also I'm thinking about, if we created a community model where we are responsible for each other, do we really need that sort of entity, right, to address behavioral health issues? Like, I don't think so. But I know that if communities feel safe, do we need law enforcement, right? If there is an investment in for us looking out for each other, why we need it? So for me, it's still an engaging, it's sort of a learning opportunity for me. But then I also talk about, also the shift that, militarization is quite differently from public safety. Like I have seen the shift with, when we say law enforcement, it's very different than we talk about when we're defending the freedom of this country. But I've seen the trend of our law enforcement gearing up as military. They have literally tanks and assault rifles were, attending a protest. I'm thinking, you don't need that. So I feel like I have a lot more thinking about this, but those are some of the pieces though, that for me, we really need to look at. Like, I don't think a protest needs a fully militarized person. You need a tank. I don't think you need assault rifles, right? So that's one part. The other part is really safety, right? Is it really thinking about our public safety differently? If we are involved more in community work and our folks are more involved, well, we need that kind of environment. But also thinking about how important, our law enforcement is, in sort of in community and where that they fall. So I think for me, it's sort of an evolving, thought. And I know that in many of the conversations that I've had, people say, well, Jay, you have to make a stand. And it's okay to say, I'm not sure yet where I stand. But I know behavioral health, or the folks that are trained in behavioral health, we don't want to respond with law enforcement. If we can decriminalize mental health, we are going to do everything we can to decriminalize mental health, to respond without any law enforcement involvement. We would do that. And that's really important for us.
Excellent points, Jay. Yes. And I think there's a lot to it. So I think that conversation specifically, especially in regards to behavioral health, will continue. And we encourage everyone who's kind of listening to kind of ponder on that and think about that and what the steps might be moving forward. Awesome. And then one was actually a comment. So thank you for the comment. And thank you for the previous question. So the next question, how did you approach mental health and racism with your parents / more traditional family members? In Asian American households, it is a difficult topic to bring up.
Yeah, and it's still a continuing conversation. And I have multiple stories. If we had more time, I'd tell you some of the stories. I have come to realize, and I think I told you I turned 50. And, and I have come to realize that, at least for my family, that they did the best that they could, knowing what they knew. When I was growing up, given, some of my experiences of being, part of the LGBTQ community, and, seeing that, not having any words, and some depression there and some depression with my family members, really just talking and telling stories. I want to say to you, when I graduated from my grad school, and I was a psychologist, and I was obviously in my 30s, one of the things that my mom said to me, and she said, well, I'm kind of worried that you have this profession, but why would people come see you when you have issues, right? Why? Because why, even if you're a degree, why would people continue seeing you because I was, at that point, didn't come out yet as a transgender man, but, why would see you when you can't fix yourself? I remember really upset about that question, but then, I turned it around and reframed it and saying, I have some work to do to really be more compassionate with people who just don't get it. And I think for me, it's really just being true to oneself. I had said this to Jessica, that I think my goal in life is that when it's time for me to, when I'm being called, wherever I'm going to be called, the question is not, oh, how many awards did you get, or how many accolades, or how many letters behind your name, or how many people did you save? That's not the question that I'm going to be asked. The question is, were you happy? I'm going to say yes, I was happy because I was authentic to myself. And because I was authentic to myself, I was more compassionate to other people, and other people benefited from that compassion.
Thank you, Jay. Yeah, and I just wanted to add too, I think one of my favorite quotes is, do the best you can, and when you know better, do better. So I think, like, even my family with my Latino parents, grandparents, like, they're open to listening and learning now. They're realizing that me as the grandchild and as their child, that I have a lot to teach them, because I grew up in a completely different world. And so having those difficult conversations, just kind of starting the ball rolling, is sometimes all it takes, even if it's hard at first.
And to not give up, right? So that could have, that comment from me, from my mom, or could have just stopped it, but I continued to engage in a conversation at my terms. And I'm hoping at this point in my life, she's proud of me. And if not, I still love her, and I think that's the compassion and the humanity that sort of is needed.
Absolutely. Thank you so much, Jay. Okay, I think we could do just one more, and then we'll wrap up and take a break. So this one is, how can we start having deeper conversations about white supremacy with white folks?
Well, and that conversation could actually be turned around to our white colleagues. So I think in some of our work statewide, I'm actually helping white folks engage in a deeper conversation of what that looks like. I think because that's really a hard conversation. And I feel like inviting a white colleague to just say, let's have a conversation, I think can start it, right? I think always relying on people of color to talk about racism is really not a good idea. I think another concrete idea is start learning more, and not learning more, reading. I mean, there's so much stuff right now that's being published or republished about, racism or white supremacy or racial injustice, online, free. I think at least start with that, and then reach out to white folks and have that deep conversation, and to really create a safety for them that's separate from just having other people of color or other as part of that conversation. I think to just start with one person and having a dialogue, and then sort of be really real about it. Like, I really don't get it, or I disagree. So I think that is the first step. Learn more and engage with another person in a conversation.
Awesome. Thank you so much, Jay. We're going to wrap up there. I know we have some questions that did not get answered. But definitely feel free to send them our way. We're going to post our contact information. We can pass that along to Jay and then get his responses to all of you that way. So thank you again so much, Jay. We look forward to having you for the next couple of days for whatever you're able to join us with. And thank you to everyone who has joined us today. We're going to go ahead and take a 5-minute break, and then we'll come back and introduce our workshop presenter.
Thank you all.
Everyone.
Thank you.
Thank you, Jay.
You're welcome.
All right. Welcome back, everyone. I just wanted to welcome everyone back from our short little break. We're going to move into our workshop. I want to introduce Mirna Juarez. I'm sorry, Mirna, if I said that wrong. And I just also wanted to let everyone know that my name's Ragni Lal. I didn't introduce myself in the beginning. I realized that, so hello. You probably got emails from me. But yeah, so I just want to move on and move into our workshop, Smudging for Healing by Mirna Juarez, owner of Fireheart Botanicals. Mirna?
Hello, good afternoon, everyone. That was perfect. Mirna Juarez, and in Nahuatl, I was named Chuyolot. In Nahuatl is the native language of Mexico, and so that translates into Fireheart. And I want to say thank you to Brianna for the call to come and do this for you all. I want to say thank you to Dr. Africa too for that trigger warning, and also for taking a broader approach that includes colonization as part of the conversation of racism. So for me, the process of decolonization has brought me to smudging as a healing art, and so many other things that have really helped to transform the way that I have taken my healing on for myself. I identify as a consumer and also a family member. And so I had my fire lit ahead of time. I want to talk about the process of actually preparing for smudging. And just a little background, my ancestry is from Durango, Mexico. I am Tarahumara. That's a tribe in the Sierra Madre Occidental. That's the Raramuri tribe. And also, in growing up as a Chicana and learning from the Chicano movement and the embrace of our indigeneity. So I also have just received degrees in plant science. And so just bringing together the spiritual and the science of smudging has been really powerful for me. And I just want to be able to share that with you. And I thank you for that opportunity. So I'm going to start off with the process that I take, that I was taught traditionally for smudging for myself and for others. And so I start off with, this is Agua Florida, Florida water, or I think it's by the French name Eau de Toilette, or basically it's an astringent. And so it's just for like a cleanse. A lot of us are familiar with this now that we use hand sanitizer very often, but just to kind of like clean yourself off before you start to do this work. And so I just use a little bit. It's an alcohol base. This one I made myself. And so it's just basically just essence of flowers. And start with a clean slate, an empty vessel. And speaking of vessels, this is my poposhkomi that was gifted to me by my teacher, my mentor. And it is a clay container. I'll bring it closer so you can see, with handles, and I use hot coals inside. And I'll show you right now. And so I've been told by some of my older aunties in the Native community. We call our elders sometimes aunties. We are all relations, right? We're all relatives. So one of my aunties calls these cheaters. These are self-starting coals, and you can buy them at like a smoke shop, or they're actually used for traditional hookah smoking. But the alternative to that, and I have this here to show you, is using fire starters like ocote, which is just like a pine stick, and like mesquite coals. And that of course takes a lot more time and causes a lot more smoke. So I'm gonna do it the cheater way for you today. And I still use ocote just because it's allows me to keep my fingers away a little further than the lighter does. And I just hold it over the self-lighting coal like this until it starts to sparkle. And then I put it down. And so that has a little bit of chemical in it. And so that's why I really prefer to do it the traditional way. But, you know, that's a little more accessible many times. So once that's on, then I'm going to talk to you about the herbs that I use. I went and picked these from my sage bush today. So this is traditional white sage, Salvia apiana, and this is the most common, you know, smudge herb. And it can be used in smudge sticks by just wrapping it with yarn. Here we also have a smudge stick, and I've been using it a lot this week out of cedar. And so when you use a smudge stick, all you do is just light the end of it. And this is once it's dry. So like if I were to wrap this sage, I would have to wait until it's dry to use it. And a smudge stick can be used in place of like a clay container and coals. And so these smudge sticks, we created it with Energy Cooperative so that we could gift them to people who needed antiviral help who were affected by COVID. And on July 4th, my husband was diagnosed COVID positive. So this has been really essential right now for me and my family. I apologize for my emotional state because it's been hard, but this helps. And so the therapeutic aspects of like the aromatherapy that I wish you could all smell today, but also the science of the fact that these herbs are antibacterial, they're antiviral, and that the smoke actually cleans the air. And you can look that up, but it's very effective at taking germs out of the air. So this is flat cedar that's been wrapped up, and it's incense cedar. These trees are, and we're very lucky in California to have them accessible to us. And so I've been using some of the sage and also some lavender. This is a little satchel of lavender flowers that I have just taken off the, taking off the stems, and it's just flowers. And so thank you to Dr. Africa for that trigger warning. And I'm very thankful that I had this accessible because the smell of lavender can help ease my anxiety many times. And I have this up here to show you all too. An alternative to when smudging is not accessible is using like essential oils. And so lavender is something that I rely on for anxiety control. And so that's something that I find very, very encouraging, that there's something other than pharmaceuticals that will help to soothe symptoms of an anxiety attack. And lavender is one of my favorites. One other thing that I'm using is a traditional resin from Mexico. copal, and I'm gonna show it up close so that you could see the spelling. I don't know. See that? Copal is the resin from Mexico traditionally, and the smoke from this, the smell from this is for purification and for strength. And so, you know, in the wake of the police brutality that has come to a head, it's not that it just came to light or that we just experienced it, it's come to a head. I have been able to go out into my community. I'm sorry, okay, a little question for me there. But I've been able to go out into my community with a mask on, light my smoke, and offer smudge to some of the mothers who have lost their children to being killed by police. And so it has been a very vital tool, you know, just to kind of calm the hearts and the rage that is out there right now. You know, but of course, you don't need somebody else to smudge you off. We each can do this for ourselves in our home. And it is an excellent way to ground yourself. And I'm gonna take a little knee here. And here I've kind of done a little like altar of sorts. What I include always in my altar is a little something for each element. So I have some water here. I have the fresh plants to ground myself with the earth energies, and the shell that represents the wind, and then the fire. And so very simple practices that come from ancient traditional teachings have really helped me to ground myself, to control, or at least be able to digest some of the emotional, overwhelming responses to what we're living in this moment, right? I mean, the world was already difficult to navigate for me as a consumer and as somebody who is of service to and a relative to, you know, people who suffer from mental health ailments, you know. And this way of life, this traditional way of life, it's not something that I was born into. It's been a process. So yes, both my parents are from the same region and in Mexico, and they have, you know, relatives who are traditional, you know, indigenous people. But because of some of the things that Dr. Africa talked about, in our generation now, we are starting to go through a process of decolonization. And I just kind of picked up a book from our collection. I didn't know he was going to talk about that, but I wanted to mention that. And this is a book called 1492, What Is It to Be Discovered? And so I don't know if there is anybody who you know, needs a little bit more of on that history, but you know, the process of decolonization is something that is very, very personal and has been like a process of self-discovery for a lot of people. But it hasn't actually been like a structural process in society yet. And I think that right now we're starting to see that, I hope. But this is the way that I've been able to do it for myself, is to take these traditional things that are very basic, that are, you know, tangible, undeniable, non-changing, to really ground myself and be able to move forward with other parts of the decolonization process, like standing up to racism, even within my own family, and standing up for myself and my rights, and to really question the practices that are in place, like these common practices that we do all the time because they're just what we always do, and really start to step back and look at it like, but should we? You know, just lots of things in your life that like, oh, well, I'm going to do it because it's what we've always done. Well, what can we do different? And as far as mental health, you know, I really think that meeting people where they are, it has been really valuable in my experience. And just to give you a little bit of background, I worked with the MHSA program here in San Joaquin County with children's, and unfortunately I was in a vehicle accident and couldn't manage assaultive behavior, was not able to keep my job as a case manager working with children. But I have continued to be involved in the community through cultural presentations and giving, you know, talks like this to formerly incarcerated people, to youth, and mothers. And so what I hope is that even a little bit of this information can help someone to settle, to ground themselves, to be able to use smudging to help to calm nerves, and reconnect with the things that are constant, right? The things that are true, the earth, the water, the fire, the air. Those things won't change. They're being affected, and there is that battle, and there are so many right now, but that connection to earth and using earth's medicine is very, very healing. And I invite you each to, you know, tap into it in your own way. Every tradition, every ancient culture has connections to herbal medicine, and definitely consult with your doctor before using any herbal medicine. But we know that smudging is something that's not going to interact with anything because we're not actually consuming it. And so I know I've given a lot of information. I don't know if there's any questions or comments. Oh, Mateo.
Thank you, Mirna. So hopefully you're able to see the chat box. We have had quite a few comments directly for you, so we want to make sure that you get to those. But we did have, I'm going to scoot back a little bit. And there was a question up here. Let me just try to get back to it.
Try to get to the right screen. I'm sorry.
No worries. Take your time, Mirna.
I don't know. There you are.
Okay, so somebody said, if I may ask, how is the practice of smudging different than incense burning? Is it what is being burned, or why it is being burned, or is there a ritual process to the burning of the herbs?
There is it's very similar. It's just a different method that it's in a you know, incense stick, and I've also used incense stick. And the intention behind it is what is the significance, you know. Really kind of like getting to a quiet space, you know, being in a purposeful mode, as opposed to just, you know, to make it smell nice.
Yeah, definitely. Hey, Mirna, I'm not sure. Ragini, I'll check in with you. Is Mirna, is her screen frozen, or it may have just been my computer.
checking the chat.
Oh, so it probably paused you. Okay.
Yeah.
Perfect.
And so if you can just kind of share with me what's on there, because it's very hard to see.
Yes, I will. So there's quite a few messages just offering healing to you and your husband, and sending all their love and energy to you in this time. And then somebody else asked, how do you feel about non-Indigenous persons practicing smudging?
I personally feel like it's great. I think that, like I mentioned, every culture has traditional use of herbs. You want to tap into your ancestors and connect that way. That's great. One thing I do frown upon is like for example, sage that is out in the landscape in the wild has been over harvested for purposes of sales, and so really being respectful, and that's something that I skipped in the mentioning. I did mention that I harvested this sage from my own plant this morning, actually this afternoon. This morning I went to take my daughter for COVID test, but this plant I harvested from my own garden. Had I gone to forage this somewhere, I would have done a tobacco offering, ask permission from the earth and from the plant before I take some, and never take more than I need. So that's the traditional way to harvest your own herbs. Over harvesting is a problem, so that's the only thing that I would, say be respectful. And, you don't need to appropriate anything else from another culture to practice it. You respectfully practice it, but tap into your own traditions and to your own ancestors. That's a beautiful thing to do. Another ritual that we do as a part of Aztec dance is the calling to the four directions. And when we do that, we hold the smoke, we face to the four cardinal directions, to the sky, to the earth, and we blow the conch shell. And when we do that, we're calling to our ancestors. But we're not calling just to our ancestors. We're calling to each direction, to each station of life, to all ancestors of everyone present. So it's not something that is just for Indigenous people. These traditions are for human beings. And it's for our connection to the plant life, to the animal life, to the celestial life, to the earth, and the life in the ground. So it's really the interconnectivity of all living beings.
Thank you, Mirna. And that's so important because I think that's something that people often don't think about. So thank you for bringing that up. We have another question asking, does the vessel make a difference when burning the herbs?
It does in this way, and I wanted to show you. When I brought it closer, I showed you that it has handles, but it also has a hollow space here. I don't know if you can see, my hand can go all the way in there. And this helps to prevent you burning the surface that you place it on. My smudge stick, I kind of have it catch the ashes into this ceramic bowl. And this bottom here, if I had put a coal here, this bottom would get too hot and it would possibly light the cloth on fire that I put it on. So for safety's sake, it should be something that's ceramic, preferably. Metal could work, but it really does get too hot. A lot of people use a traditional abalone shell. The abalone shells for smudge sticks are okay, but not for coals. If you put a coal in an abalone shell, that will get too hot. So it matters for safety's sake.
Thank you. Someone else just said, I Googled smudging and there are smudging kits available. Are those just as good, or what are your thoughts on that?
That is part of, I think, the over harvesting of herbs, is that sometimes even corporate companies will make smudge sticks or smudge kits. And I just would really question the sustainability of your source, you know, and yeah, that I think that wherever you can come across your healing tools, more power to you. Personally, I like to be assured that it's a sustainable and respectable source.
Yeah, absolutely. And I would just agree with that. I think there has been like the kind of turning it mainstream, and so companies just trying to turn a profit from it. But it's actually really easy now to kind of like go to the website or go to the Instagram and find like who is the source, how are they harvesting it, how are they collecting it, was it done in the right intention? So just kind of figuring out how to navigate that. Awesome. And then we have another question here. Let me go up just to make sure I didn't miss one. We have a comment here that says, that's wonderful. My white therapist mentor introduced this to me years ago as a teen. Thank you for saying that and for giving permission, quote unquote, for those who may not know and would never want to disrespect the tradition and the culture behind it. Awesome. And then another question here. Can you share on the properties of Palo Santo?
To be honest with you, I'm not too familiar with Palo Santo. I do know that there is the same problem with overharvesting. And I would say with any, you know, herb that you use, to know what its purpose is, what are the properties, what are they for. There's a lot of really great sources on herbal medicines and what their specific use is for. But I would say the same thing, you know, go to somebody or buy it from somebody that you know traditionally harvests it, sustainably harvests it. But as far as like the use of Palo Santo, personally, I don't practice it the way that I do these herbs. Yeah.
Great. And we did have some questions. We are going to compile the list of the items that you used today, but do you mind just running through them again, everything that you said? Because I know people wanted to kind of jot them down.
Absolutely. And so what I started with was the agua florida. And really quickly, the way that I make this is I collect flowers and herbs that I grow myself, and I mix it with Everclear and then dilute it with water. And so this is what I use for cleansing. This is lavender flowers. And so these I harvested from my garden. Again, if you harvest lavender, I've seen it in parking lots, just respectfully, sustainably, you know, you don't want to like go to your neighbor's lavender bush and just whack it all off. Ask permission, not just from the landowner, but from the land and the plant itself. And so this is actually specifically French lavender. And so other lavenders will work, but this is the one that is the most commonly used for aromatherapy. And I believe the name is Lavandula angustifolia. That's the botanical name.
Yes, we have our plant major, Mirna, over here.
Yeah,
congratulations again.
Class of 2020. Shout out to the entire class of virtual graduates. And this is sometimes called flat cedar, incense cedar, and cedrus. I might get in trouble if I don't know. But it's, I'm going to show you one of the leaves. But it's called flat cedar because other cedars are kind of round and this one is very flat. And so this is, the common name is incense cedar. And so that, and I picked these herbs because they have antiviral properties. And so I've been using them a lot in the home lately. And so the white sage, the Salvia apiana, this is it fresh. I don't know if you guys can see it very well. And this is where I'm selecting out of here, just dry leaves. So as opposed to putting it into smudge sticks, I just dry it and put it in a little basket. And so this, I'll put on the coal. And you'll see now the coal is pretty white. So that means it's very hot. And I use a traditional hawk band that I made to just kind of, you know, diffuse the smoke and spread it. And so this is used in traditional limpias to cleanse. The other is the copal. And I'm gonna take it out so that you could really see. It's very beautiful. It's the resin from the copali tree in Mexico. And this is, it almost looks like a crystal. Very beautiful, and the smell is amazing. As a traditional dancer, I've been asked many times, how do you guys dance so long, so hard? And this is the answer. It literally uplifts your spirit and gives you strength. And so a dance ceremony is one thing, but the ceremony of life and, you know, having that stamina to live through these times, Gopal can really help with it. And I just kind of bite it to chunk off a piece. Put that right on. And I know maybe virtual, but feel free to use this. The healing properties are, you know, all of the intentions of this symposium, the intentions of Dr. Africa, and the hopes for, you know, putting a stop to systemic racism. All of those intentions are going up with the smoke to Creator. Those are my traditional beliefs. I see a question right now about the name of the clay pot. This is, the Nahuatl name is Poposhkomi. So this is traditionally known as a Poposhkomi. In Spanish, it's referred to as a sahumador. It's an incense burner.
Awesome. So going back up to some questions that were added while you were discussing, do you have any mantras or specific sayings to keep grounded while you are doing the smudging?
I do have a mantra, and usually while I'm doing smudging, in my teachings, what I was taught to do is when I am carrying smoke, I am a vessel. I am empty. I put aside myself and I am a tool. And so when I do it for myself, then I really, you know, get down with my inner workings. When I'm doing it for community, I am just a tool. And that is, you see the traditional wear that I have on. This is to protect my third eye. My hair is in a braid to limit the sensitivity. I have feathers, I have beading. This is all protection, like a shield, so that I can be shielded from my own experience and be able to just serve as a vessel. But when I do practice it for myself in my own healing, this is a mantra that I have created and used for myself. And it's an acronym to help me remember is ASPAC, as Tupac. And it's not just as Tupac, but accept strength to persevere and accomplish calm. I'll say that again. Accept strength to persevere and accomplish calm. That's my mantra.
I love it. Thank you for sharing, Mirna. That was beautiful. I need to write that down. So I'm gonna do that real quick. And then I'm also gonna continue. So somebody asked just a general question, is rosemary used at all?
Yes, yes. And rosemary is an excellent invigorating herb that helps with concentration, attention, focus, and memory. And actually, I'm very thankful to rosemary for my 3.3 GPA.
Absolutely. Somebody in the comments also said, thank you so much, Naomi. She said, local herbs from local herbalists are always the best, along with growing your own. But she did mention a couple Mountain Rose Herbs and Healing Spirits Herb Farm and Education Center have sustainably harvested herbs. So
Wonderful.
thank you for sharing that. All right, going back down. Thank you also to everyone who is commenting and asking questions. We love this. This is awesome. Perfect. Yes. And then we had a couple people actually type in the mantra so that everyone could see it. All right. So unless I missed a question in the chat, I think that's it. So Mirna, thank you so much for taking time today and for being with us in this difficult time. We are all sending you love and strength and energy. And we just want to ask, is there anything you want to close on? Is there any last words that you want to leave folks with to feel calm, to feel empowered, whatever you want to leave them with?
Yes, I don't want to lose this opportunity to really thank my partners. Energy Cooperative is a group of very diverse, beautiful people who do different healing modalities. And I'm very, very lucky and proud to be part of that group. And so some of my counterparts have been out at different actions with smudge sticks, smudging, protesters. And so it takes a village, and just very thankful to Energy Cooperative and our greater collective Stock Solid for the work that they're doing in Stockton. And I want to say thank you to you, Brianna, for bringing us together, and really powerful keynote, Dr. Africa. The entire scope of what's going on and the transformation that I believe is about to happen in our country is very hard work. It's very worthwhile. I think that each of us, starting from within, can transform the negative norms that we have in our society. And I challenge for each one of you to start from within, work with your family, and then your community. And we can do this. We can do this together. And we can do this while being well. Thank you.
Thank you, Mirna. We appreciate you so much. And thank you to everyone who is attending. I'm going to pass it over to Ragini so she can just close up and let us know what we're doing tomorrow for those of you that are joining us tomorrow. Thank you again to everyone. Mirna, we appreciate you, love you. Take care. And yeah, Ragini will wrap it up.
All right. Thank you, Brianna. Thank you, Myrna. And thank you, Jay. It's just been a wonderful day with such amazing information. And I'm so glad for everyone who joined us today and your lovely comments and all the support that you showed for Myrna. I think we like all appreciate it. So just to kind of wrap up into the day, this is day 1 of the 3-day series for the Multicultural Symposium. There's still day 2 and day 3 left tomorrow and Friday. Tomorrow we're gonna go over, we're gonna have another keynote, Tiffany Ross, and then we're also gonna have interactive breakout sessions where we'll actually create like a little action plan on 2 separate populations that you get to choose. There's criminal justice system, and then there's immigrant population. So those are the 2 main pieces that we're going to go over tomorrow, and then Friday we're going to continue that. But otherwise, the only thing I have to add is that I will be sending everything. I'll be putting it together, a lot of things. It's going to be a pretty massive email that I'm going to send you probably end of Friday or on Monday. But you'll be able to get not just today, all 3 if you're not able to make it tomorrow or Friday as well. So, and I think that's it. If we will see you tomorrow. If not, I hope you have a wonderful week. Thank you so much again. And yeah, that's it. Bye.